It's National Brain Injury Awareness Month. Traumatic brain injuries affect how the brain works. Even a mild injury or concussion can be serious, and the traditional way of diagnosing a problem is a CT scan. But in today's Your Healthy Family, I'm showing you a new test doctors say will help detect brain injuries.
It's a blood test researchers say can help doctors decide if a CT scan is needed for patients with mild traumatic brain injury or a concussion.
10% of these patients actually have a significant injury on their CT scan. And so it's important for us to find those 10% and make sure we get a CAT scan on them so they can be treated promptly.
Emergency medicine doctor Linda Papa says the blood test can help identify those patients. She's the lead author of a study published in JAMA Network Open that looked at the accuracy of the test. She says by identifying 2 biomarkers, doctors can also reduce the need for CT scans for everyone who goes to the hospital with a mild brain injury, reducing their radiation exposure.
That blood test would help us make that decision and say, you know what, the blood test, the value is very low. That means the patient likely does not have a significant brain injury, and we can forego the CAT scan.
That's especially important for children. Dr. Papa says they're especially vulnerable to the effects of radiation. In the latest CDC data from 2019, about 15% of all U.S. high school students reported a sports or recreation-related concussion in the year before.
As children grow, you don't want to expose them to unnecessary ionizing radiations because they're growing, their cells are changing.
Now, she says these biomarkers in the blood test have been studied for 20 years, but the process is now FDA approved and being used in clinical practice. With today's Your Healthy Family, I'm Lisa Greenberg. And for more health stories, head to fox4now.com/yourhealthyfamily.